Hey there guys, it's Dr. George here from thehealthybear.com.au, and today I thought I'd give a little bit of an overview of oral sex. In particular, some of the health issues that can be associated with oral sex. Now, the statistics are finally in. There was a study just published this week that showed that of all of the sexual behaviours that gay men have, 72% enjoy oral sex on a regular basis. And if you compare that to the fact that 37% said they only ever had anal sex on a regular basis, I think, it's probably worthwhile addressing some of the health issues that can be associated with oral sex. One of the things that people worry about the most is HIV when it comes to oral sex. But the facts are that we don't know how many people have contracted HIV through oral sex, but we do know that the number is low. The particular risk of contracting HIV through oral sex is low, and there's three main reasons for that. The first one is that saliva is inhibitory to the HIV virus. It helps break it down, it stops it from being able to penetrate in through the mucous membranes. The second reason is that the layer of skin inside the mouth and also inside the throat is difficult for HIV to penetrate as well. And finally, that for HIV to be able to get into the body, it needs to be able to connect with particular types of cells, and there aren't many of those in the mouth and in the throat. So for that reason, when the mouth is intact, the risk of HIV is actually quite low. That being said, the current recommendations are that, that you don't take cum inside your mouth. And if there is cum inside your mouth, you have to make a decision, swallow or spit, just don't let it sit, is the basic rule. So don't sit there gargling it, for God's sake, get rid of it. In or out, swallow it, whatever. If you swallow it, it's going to get chewed up by the acidic environment of the stomach. If you spit it out, give your mouth a good wash. If you've got some soft drink or something like that, that will is acidic enough to kill the virus as well. If though, there are a couple of things that make HIV more likely to be able to be contracted through oral sex. And the first one is if you have any cuts or sores in your mouth. In particular, if you've got like a cold sore on your lips, that increases the risk quite significantly. If you've had recent dental work or you notice that your gums are bleeding, they are open cuts, they're sores that allow HIV to go straight into the bloodstream. So that's one area. The other thing is if you have chlamydia or gonorrhea growing in your throat, and a recent study in Melbourne showed that 4% of people when swabbed actually had either chlamydia or gonorrhea growing in their throat. If you have those growing, it does greatly increase the chance of contracting HIV as well. So what can we do? Basically, have good care of your teeth. Look after your teeth very, very carefully. Brush your teeth every day, twice a day. If you're planning on having sex though, don't brush your teeth an hour or so before you're planning on having sex. You can perhaps use Listerine or some sort of mouthwash instead to freshen up your breath. You can chew some gum, but sometimes the micro trauma of the toothbrush against the gums is enough to create a small cut that could theoretically allow HIV into the system. The other thing is to make sure you get a regular STI checkup, and that includes a swab of the back of the throat. Because, as I said, the study in Melbourne showed that when people felt that they didn't have any diseases, they did a swab of the throat, and 4% came back positive for either chlamydia or gonorrhea. If you have those, the chance of getting HIV that way is significantly higher. On the next topic is probably more important, is that we understand that HIV is a low risk activity when it comes to oral sex. However, gonorrhea and chlamydia is very, very easily passed on through oral sex, as is herpes or cold sores. That's very easily passed on as well. So, we need to be aware of the things that are more likely to happen. So if you notice that there's a pussy discharge coming out of somebody's dick, I would probably gently suggest to them they might need to get an STI checkup, and also to, I'd kind of avoid sucking on that dick, to be honest. But then again, you never know there are people who can have chlamydia and gonorrhea and not have much in the way of symptoms at all. So it's okay if you're going to suck dick. It's just important to make sure you get a regular checkup, and that, as I said, includes a swab of the back of the throat, and not many of the doctors outside of the gay world are doing that these days. So I'd highly recommend that. If you've got a cold sore on your lips or anything like that, you're going to have to avoid oral sex for two reasons. One is because it makes it easier to get other diseases, but the other thing is that you can pass it on to other people, and it's one of those diseases that really sucks, and you wouldn't want to pass it on to anybody else. I would hope. Please don't pass it on. It's a bit of a feral disease. The other thing is that some people can have syphilis sores inside their mouth as well. We don't really know about those because they're usually painless, but again, that's part of a regular sexual health screening as well. The final note is a little bit controversial, but there's now evidence coming out, and this stuff is not being talked about, and it's really, really important. And that is about the virus that causes genital warts, the human papillomavirus. Now, it's a very important virus because we're now finding out it's got more to do than just warts. What's happening is that there is a slight increase in the amount of oral cancers that is around in the community. And what we're finding is that 90% of those oral cancers are HPV positive. That is, they have the virus, the wart virus in them. So that's the most likely cause that's led to people getting the, that particular form of throat cancer. And the government has set up a very interesting situation. What they've done is that over the past 5 or so years, that a vaccine came out to help prevent people from getting the wart virus. But there's a catch. Only half the population were given the vaccine. And, you know, part of it was economics, because the vaccine's really, really expensive. And the other thing is that they said, oh, well, if we you know, just vaccinate the women, that will offer protection for the men, because the vaccine's designed to help prevent cervical cancer. So we'll just vaccinate the women because it's cheaper, and, you know, that way half the population's sort of done. Unfortunately, they forgot about us. You see, if the men who are having sex with men are totally removed from the people who've already been vaccinated, that just means that it's a wonderful pool for HPV to grow. So there's going to be a bit of a potential increase in the amount of oral cancers, and that's already on the rise as we speak. So in the UK at least, they've decided that they're going to start vaccinating the men, which is great. I congratulate that a lot. And I think the movement is just starting to happen here in Australia for HPV vaccination of young boys as well. The idea is to vaccinate before you've been exposed to the virus, but we know that even if you've had genital warts, even if you've had some sort of exposure to HPV, that the vaccine offers protection to the other strands as well. The current one, like there's one called Gardasil, it covers 4 of the main viruses that cause warts, but also throat cancers as well. So I would like to maybe put something out there and to consider talking with your doctor about getting the HPV vaccine. It's expensive, but it may help prevent some significant health issues in the future. And I would like to suggest that you consider getting it done. It's 3 injections in a row, but it is shown to be very effective. And whilst we're not going to get cervical cancer, we are at risk of cancer of the throat, penile cancer, but also just warts as well, that it can help prevent from getting genital warts as well. So it's worthwhile having a conversation with your doctor. I certainly had the HPV vaccine. It was available to me and I chose to pay for it, and I chose to protect myself against it. Yes, I was a little bit older, which means that I may not get the full protection, but it may help protect me against some of the strains of viruses that can be pretty nasty. So there we go. So in a nutshell, let's go back to the start. The risk of HIV is particularly low with oral sex. the current recommendations are to avoid getting semen inside the mouth. If you have cuts or recent dental work or any sores inside the mouth, it's probably best to avoid oral sex or to use a condom over the penis. The other thing is to make sure you get regular STI checks in the back of the throat to make sure there's no chlamydia, gonorrhea or syphilis in the back of the throat that might make it easier to contract HIV. Other things to be aware of is that, that whilst HIV is difficult to get through oral sex, there are other things that are easier, and that's chlamydia, gonorrhea, syphilis, and also potential exposure to the HPV virus. So again, get a regular sexual health checkup. And the last thing is that if you notice any growths in your throat, it could be something that's very significant, so it's worthwhile going to see your doctor. And consider whether or not you might want to get the HPV vaccine. It may be worth considering. Anyway, please, if you've got any questions, leave them in the comment section below, because I'll do my best to find a fantastic answer for you that that helps explain what I've been talking about. If you have any comments or questions, please leave a message below. Have a fantastic day. See you guys.